interact with her. And we saw this pattern repeatedly at 6, 9, 12, and 15 months, which might suggest there might be some more subtle signs in terms of expression of the social difficulties. And we are working quite intently on categorizing these signs or detecting the patterns which might differentiate children who later develop autism already at 6 and perhaps even 3 months. We also, apart from using these behavioral techniques in which we put a child into a room with an adult and we have them interact and we record their responses in the context of a live interaction, we also are trying to study their social cognition using somewhat different approaches. And I would like to tell you a little bit about the eye tracking research we do in our lab. Babies cannot do a lot of things. They cannot walk, they cannot talk, they cannot press the bar to tell us what the reaction time is going to be to certain classes of stimuli. But they can watch things, they can look. And actually, vision is, visual perception is one of the most important, apart from auditory modalities, one of the most important sources of information about the world, starting from the very beginning. We know that scanning patterns of our visual scenes are non-random, they are goal-oriented, they are exploratory behaviors, and they are affected by a number of factors which are important, always important to consider when we study visual cognition using eye tracking. Scanning patterns are affected by the perceptual properties of the scene, having to do with motion, high contrast areas, color, sudden onset of the stimuli. They are very likely to attract our attention. But they are also driven to a large extent by the semantic properties of the visual scene. What we know, what the perceiver knows or thinks and feels about the perceived scene. With regard to faces, a very simple example is that we scan faces of people we know very well quite differently than we scan faces of strangers. Also, evidence from developmental science suggests that scanning patterns are likely to be affected by age. They change with age. And also studies on other disorders besides autism suggest that they can be affected by, for instance, schizophrenia, bipolar disorder, as well as autism. So in my lab, we are quite interested in a number of phenomena associated with face perception. And in this particular study, we have a 6-monther who is engaged in a face recognition study. We are asking this little baby to encode an identity of a new face, and then we test her on what she's learned using so-called visual paired comparison paradigm. You might be able to see this red dot here. I don't know if you can see it with the lights on, but this is her point of regard. And she's a marvelous looker, very attentive little baby. And here we ask her to compare the familiar face and the novel face, and that's pretty much end of the first phase of the experiment. What we do with this kind of data, we can summarize it globally by where the child is looking. These are a summary of her scan pads over this face you just saw. And as you can see, as in a typical 6-monther, she's not very, she's not terribly adventurous in terms of face scanning. She spends a lot of time looking at the eyes in a static image of the face. Just to give you an idea what kind of studies can be done or what we do in our lab in terms of face scanning in infancy, we are interested, for instance, how face scanning changes depending on the context in which faces are presented. And in this particular study, we had a cohort of children follow from 3, 6, 9, and 12 months, and we showed them 3 kinds of faces. In one case, it was a static face, pretty much like the one you just saw before. In another case, another condition, it was a image. It was a movie of a person smiling. So it was a dynamic stimulus. There was no speech, but there was motion and affect. And then we had another movie in which there was some motion, but the person was reciting a nursery rhyme. What was very interesting to find is that children actually adjust their scanning strategy depending on what kind of faces they are looking at. So if they're looking at the static face, most of the attention is distributed toward the eyes as compared to the mouth of the person. And it's true both of 3-monthers, 6-monthers, 9-monthers, and 12-monthers. When we look at the smiling face, the distribution changes somewhat. Attention to mouth increases, attention to eyes decreases a little bit. With the idea is that in order to read the emotion, you need to get information both from the mouth and also from the eyes to truly appreciate what is the person's affective expression. Things get even more complicated when we show babies' faces. They are talking because starting at 6 months, in this case, they begin to actually scan the mouth area more frequently than the eyes, especially when they are 6 and 9 months old, which we hypothesize helps them understand speech. There's a lot of nice perceptual cues in the way the mouth moves when we pronounce words, which provides some visual input and support for understanding language. So these are only typical babies. We will be mapping children who are developing autism onto these normative data to try and understand how much sensitivity we see in that cohort with regards to the types of faces children are experiencing. Now, I have no watch, so I have, okay, 5:30. We have still some time left. Yeah. All right. So at the end, I would like to talk a little bit about studies on face processing that we conducted on toddlers. We have cataloged pretty well the behavioral symptoms of autism. We know about joint attention. We know about deficits in dyadic social interaction. We know what kind of repetitive behaviors we can expect in children with autism. But symptoms of autism pervades also other areas of functioning. And one of the areas of functioning it affects is face processing. And from studies of older children and adults with autism, we know that they have difficulties in face recognition. They appear to employ different face processing strategies, which might be less effective, resulting in difficulties in face recognition. And also when they look at faces, they recruit somewhat different neural mechanisms to learn about them and to process them and remember them. Now, most of these studies were conducted on adults and school-age children with autism. What is actually interesting about faces, that face processing develops over a very prolonged period of time, starting at birth and reaching adult stages somewhere in mid-teens. And what we've learned thus far about face processing in autism, we've learned in a way looking at a certain developmental endpoint. And in order for us, what's very fascinating and very interesting to know is not only what the endpoint is, but how the children got there and what were the initial states of their face processing system. Whether these deficits were primary or secondary, do they emerge sometimes within the first year